Good afternoon, everyone, and welcome to the Long-Term Care Best Practice Spotlight Organization Information Webinar. We're beginning the presentation now at 1:00 p.m. And for those of you who may not have called into the teleconference line at this point, the numbers are on your screen. We've asked you to put your phones on mute, although you've been entered into the conference on mute mode, and we will be taking questions at the end of the presentation. I just certainly wanted again to welcome all of you today. My name is Heather McConnell, and I'm the Associate Director for Guideline Implementation and Knowledge Transfer at the Registered Nurses Association of Ontario. And with me is Suman Iqbal. Suman is the Senior Manager of the Long-Term Care Best Practices Program, and the two of us are responsible for the Long-Term Care BPSO initiative within the Registered Nurses Association of Ontario. So just a couple of highlights here around the WebEx meeting features. At a glance, you'll be able to see that at the top right-hand corner of your screen, there's a button that you can push, little arrows on either side to make a full screen. You'll also note that on the right-hand column or right-hand panel, there's a participant panel, and there's also an opportunity for Q&A at the bottom. So please feel free during the course of this session. If you have any questions, you're welcome to type them into the Q&A panel, and we'll respond to those at the end. Or alternatively, when we do complete the presentation, we'll offer the opportunity for any questions that you might want to take through the telephone line itself. So the objectives of the session today are to describe the Best Practice Spotlight Organization Designation Program and the process for becoming a long-term care BPSO. We'd like to review the eligibility requirements for organizations interested in applying. We'll also have an opportunity to hear from two of our current long-term care BPSOs so that they can share their experiences with you. We'll discuss the details of the pre-designation deliverables, and along with that, describe the supports that are provided by RNAO, and as I said previously, we'll have an opportunity for your questions. So the Registered Nurses Association of Ontario is the professional association for registered nurses, nurse practitioners, and nursing students in Ontario. And the Best Practice Guidelines program is a signature program of the RNAO, and along with that, of course, the Long-Term Care Best Practices program. So the program mandate has been to develop, disseminate, and actively support the uptake of evidence-based clinical and healthy work environment best practice guidelines, and to evaluate their impact in patient, organizational, and health system outcomes. And we have been fortunate to have been funded by the Ontario Ministry of Health and Long-Term Care for this program since 1999. This is just a diagram of the model that we utilize to guide the work of the International Affairs and Best Practice Guidelines Center at the RNAO. And you'll note that there's a strong focus on guideline development, dissemination, implementation, and a focus on sustainability, and again, of course, evaluation and monitoring, because ultimately we want to determine what impact we're having on patient, client, or resident, provider, organization, and system outcomes. And of course, the Long-Term Care Best Practices program, which you'll all be familiar with, the mission is to enhance the quality of care for residents in long-term care homes and facilitate a culture of evidence-based practice through the implementation of the RNAO's best practice guidelines by frontline staff in long-term care homes. And again, this program has been funded by the Ontario Ministry of Health and Long-Term Care. So with the two programs coming together, we've really been able to develop a unique opportunity for the long-term care sector in Ontario. So of course today what we're here to talk about is part of our implementation strategy that really focuses at the organizational level, the BPSO. And the key strategy and the goal of the Best Practice Spotlight Organization is to influence the uptake of best practice guidelines across all healthcare organizations to enable practice excellence and positive client or resident outcomes. Organizations partner with RNAO to implement multiple guidelines over a 3-year period and attain the BPSO designation. And this process includes an application process and formal partnership with RNAO through a signed contract, The application process, of course, is through the request for proposal that's recently been issued. And then there are specific requirements which we'll go through related to systematic guideline implementation, development of an infrastructure, reporting requirements, participation and knowledge exchange, dissemination, sustainability planning, and measuring outcomes through standard indicators. And then those BPSOs, as they're designated, will focus on the expansion, spread, and sustained use of guidelines, provide mentoring opportunities for new BPSOs, and again, continuing to measure their outcomes. So this is just an illustration of the spread of our work in the long-term care sector within Ontario. You'll notice that there are 17 currently long-term care BPSOs that represent 29 long-term care homes within the province of Ontario. So obviously a number of these sites are multi-site homes. Within Ontario itself, there are 61 BPSOs representing more than 300 healthcare and academic organizations. So again, you can see the spread of the BPSOs across the province. And then internationally, we've been able to recognize that this work will only continue to expand if we have a variety of different approaches to support our international work. And so we have what we call BPSO hosts that are actually organizations that take on the role very similarly to the RNAO that will actually support sites within their designation or their jurisdiction to be able to become BPSOs. And we have 4 BPSO hosts, one in Spain, one in Australia, one in Chile, and China. So again, this is a really important piece of our work. All of the international work is funded by those organizations themselves, and none of the Ministry of Health funds or membership dollars go towards these particular activities. But you can see that it's part of a growing designation that is international. So I'm going to turn things over now to Suman, who's going to speak about the designation and introduce things.
So for the designation, the long-term care homes partner with RNAO to create evidence-based cultures in their organization, and they work with us in being systematic in implementing selected best practice guidelines into their day-to-day work. It's a partnership that lasts throughout the 3 years. They demonstrate their creative strategies that they come up with. They're successfully implement nursing best practice guidelines, whether it is in one resident home area or across the organization. They use effective approaches to evaluate the implementation of best practice guidelines using some of the process, outcome, and structure indicators. And you can also use the RIMDS indicators to monitor the evaluation. Effective strategies for making changes right across the organization, and also using these best practice guidelines that directly support the care of residents in long-term care homes. So I'm just going to talk to you a little bit about some of our, actually our first group of long-term care BPSO designates that took place in April of 2017. As you can see from the slide, we had 3 organizations, but they represented, Region of Peel actually had 5 long-term care homes included in this designation. So a total of 7 organizations received their designation or long-term care homes. For the cohort B, which is 2015 to the 2018 cycle, and their designation is coming up pretty quickly, you can see Pioneer Ridge Long-Term Care Home from all the way in Thunder Bay, and Residence St. Louis from Orleans, Ontario. For 2016-2019, this is cohort C. We had quite a few different organizations, standalone homes, large homes, and another region for Halton, which includes 3 long-term care homes. Our last cohort, which was cohort D, we had quite a few homes included in here. Niagara Region, although they have 8 homes, 3 of their homes are partnering with RNAO through this designation, and you will hear from their liaison in a little while. Tilbury Manor, Bill George in Sioux Lookout, and Woodingford Lodge also has 3 long-term care homes. So the request for proposal, which is for cohort E 2018 to 21, it's exclusively for long-term care homes in Ontario, and successful applicants will enter into a relationship that will start with the launch on April 10th, 2018, and will continue their journey through 2021. So for the long-term care BPSO, which is going to go through some of the eligibility criteria for 2018-2021, which is for cohort E. So long-term care homes are eligible to apply for this through the RFP, which has been posted on the long-term care webpage. Through this, you have to demonstrate a commitment to evidence-based practices, looking to see if you have actually previously implemented any of the RNAO best practice guidelines, to see how you have supported your staff for capacity development through our Best Practice Champions Network, any advanced clinical practice fellowship, or attendance at any of the RNAO professional development events that were run by RNAO, or any of the webinars or series through the long-term care program. We'll also want to see that you have a senior nurse leader in the role of an administrator or director of care, director of resident services, regardless of what the role is called in your organization, someone who is part of a senior management team. We're also looking to see that you have support from your board, or if it's regional, that you have support from your municipal organization. You need to have support from your senior management, senior nurse leaders, clinical staff, and if you have a unionized environment, then they need to support you as well. We also want to see if you've done any other evidence-based practice work with other organizations. Your organizational vision, mission also needs to look at how they can leverage some of the other evidence-based practices and that are related to resident safety. It could include your quality improvement plans as well. So another one is to look at how are you going to actually implement, monitor, and evaluate nursing best practice guidelines. RNAO has Enquire, which includes the collection and submission of data on nursing practice, looking at resident outcomes and organizational human resource structure indicators. We also need to have a Best Practice Spotlight Organization liaison, a registered nurse who is a member in a leadership role and who will work directly with the RNAO coach to support the implementation of the best practices. We'll also need to see some demonstrated ability to engage with successful partners or successful partnership within the healthcare community and in the long-term care sector. Looking at capacity and commitment to meet requirements for the terms and conditions for the 3-year designation, and then following the 3-year pre-designation in order to maintain that designation. Now that contract is renewable every 2 years if the terms and conditions are met. So we're just going to have a couple of the organizations share their experience with you, and they will let us share with you the process that they followed in their application and their journey thus far. So we have Susan Anderson from William George Extended Care Facility. We call it Bill George. She is the Director for Patient Care Services and also the Best Practice Spotlight Liaison. They have 20 residents because they're part of a larger organization, 7 registered staff, and 9 PSWs. So Susan, it's over to you. You will have to press *7 to unmute your line.
Good day, everybody. Thank you, Simon. Thank you, Heather. So I've been asked to talk a little bit about my experience in applying for becoming a BPSO designate facility and how the journey has impacted our home so far. The actual application process is a little bit tedious, and you have to be organized in securing all your letters of support. You want to not leave that to the last minute because they are required. And there is a lot of work and thought put into the best practice guidelines that you're going to choose to implement in your home and the reasons for implementing that. We chose for our first year the continence, oral care, and falls best practice guidelines because those were issues in our homes that we really needed to deal with based on our feedback from compliance. So that's the reason that we chose those for our home. And in year two, so we have successfully implemented those 3 best practice guidelines. Year 2, we're implementing pain and pressure injury prevention and assessments. So we're very excited to get started on those 2. I can tell you that the journey so far has been exciting and fruitful. We have been able to improve the care that our residents are receiving. It is evident in the way that our residents look and feel, and the families have really started to come out of the woodwork and express to us how wonderful they feel their families and loved ones are being treated and cared for here at the Bill George Extended Care Home. We have been supported by the RNAO. I cannot say anything bad about this organization and how they support this journey. We have been supported every step of the way. We have a coach that has been assigned to us. Her name is Heather Woodbeck, and she has just absolutely ensured that we're always on track and that we're always not only really paying attention to detail in the moment, but always looking forward. The training that the RNAO provides along the journey is outstanding, and I really do encourage any home who's looking into going on this journey, I encourage you to do it. It is a lot of work. It's not hard work, but it's a lot of work, and it's worth it.
Thank you, Susan, for sharing your information with us. So our next person is Tracy Tate. She's the administrator for Woodlands of Sunset, one of the long-term care homes, part of the regional municipality of Niagara. And Tracy, you'll have to press *7 to speak.
Thanks, Suman and Heather, and so nice to hear your voice, Susan. I am here to talk to you a little bit about our journey with the region of Niagara. So we applied for the RFP for Cohort D 2016 to 2019 in the fall of 2015. So although we are 8 sites with almost 1,000 beds, our RFP included 3 of our 8 homes for years 1 and 2, with a plan for dissemination to all 8 sites in year 3. We call ourselves the Collaborative and cover 2 cities and 3 homes. Deer Park Villa has 40 beds, Rapple J Lodge and Woodlands of Sunset each have 120 beds. Next slide, please, Suman. We have many partnerships, including 2 universities and a college. We support the community through respite, day programs, wellness programming, and convalescent care beds. We are fortunate to have a central support services team for the nursing department and participate in the One Team movement at the region. Next slide, please. So as you can see by this slide, our goal is to achieve excellence through the dissemination of evidence-based practice throughout all regional sites. And this aligns nicely with our strategic direction, which is to enhance communication, improve quality through innovation, foster collaboration, and promote a healthy and safe environment for staff and for our residents. So this was a pivotal move for us in order for our project to meet with approval at all levels of regional council and for our stakeholders internally, and to continue to have that backing and resources for the duration of this project. Next slide, please. So starting the BPSO movement, our leaders from the 3 homes came together and chose staff from across the continuum of care. So our champions included PSWs, RPNs, RNs, housekeeping, recreation therapy, and dietary. And we really found that the most important thing is to know your champions and to choose them wisely. I can't say enough about the mix of the team that you're going to plan on starting this journey with you, but you really need a mix of doers, thinkers, and speakers. And just always remember that positivity cannot have a price tag. And really knowing your champions and understanding what motivates them to ensure that they will commit to this project and go forward and sell it to others is super important. And mainly, just empower them. This is an important endeavor, and they need to feel appreciated the whole way along. So next slide, and I see they're not really advancing. Oh, they are. Engagement is key and starts immediately. So when we started this, we held a launch, and we've held events all the way through our first year and a half. And we've always tried to bring all 3 of our homes together. For anyone contemplating a multi-site RFP, this is really important for knowledge exchange, for gap analysis cross-sections, and for sharing during the journey. It really assists in solidifying your project and encourages your champions. And please invite your coach for the benefit of the team with that set of impartial ears and eyes, and just to help keep you focused as well. Next slide, please. So our first year BPGs were building and sustaining leadership and person and family-centered care, and our focus was to celebrate everyday leadership at the point of care. And the RNAO has amazing supporting tools to assist in this. So that's one thing all along this project that we found. We don't need to reinvent the wheel. The wheels are there, and you just need to ask and use them. We also engaged registered staff in what we call coffee talks, which are opportunities to discuss current events in healthcare with potential impact on our practices in an open forum. And again, a lot of what we chat about is often in our RNAO magazine. Next slide, please. So the Pines Project. This was an unexpected win for resident-centered care. So after reviewing documentation, falls metrics, and employee incident reports, our team identified an issue on our secured unit at the Woodlands between the hours of 2 and 4 p.m. So without the ability to add resources, as we know in long-term care, it's all tight, we had to become creative. And so what we did was we changed a PSW's hours from 6 to 2 to 8 to 4, with meaningful activities during that identified peak as their sole purpose on the unit. And after seeing the outcomes on the slide, you can read them for yourselves there, during that 8-week trial, it became a successful permanent implementation. So we really say score 1 for the BPSO team. Next slide, please. So we had many positive outcomes, but I'm sure you're going to want to know a little bit about our challenges as well. So in year 1, with the ability of all of our staff to transfer within all 8 of our homes, we had almost 800 transfers that year, which meant that we lost many champions, and at one point we had one home that didn't have any left at the end of the year. On a positive note, when we look forward to year 3 dissemination, we figure we'll have champions in place at all 8 homes already, so they'll at least know a little bit about what our project is. We also had a significant leadership turnover that first year, so that from the time of the RFP to the end of year 1, we only had 2 leadership champions left on our team, which was a bit of a hurdle. And of course, as all of you can understand, outbreaks, competing priorities, ministry visits, accreditation, etc., make it a real balancing act to keep the BPSO at the forefront of everyday business. Next slide, please, zoom in. And lastly, we are in year 2 now, and we need to keep that momentum going. We're celebrating milestones, we're talking evidence, we're nurturing new champions, and we're meeting regularly both in-home and as that collaborative. We're focused on our timelines, goals, and outcomes because one thing we've learned, time flies and there are deliverables that need to be met. And our leadership culture has really changed from the BPSO as a project to the BPSO as it's now the way we do our business and who we are. So I thank you for your time.
Thank you, Tracy.
And it's Heather again, and I'm going to speak now to the deliverables for the BPSO, and certainly Susan and Tracy have mentioned several of them during their sharing with us today. And again, thank you to both of you for joining us and being involved with this work. So the requirements are, and I'm going to go through this in some detail, and it does really follow the structure of the RFP. So if you have a copy of it, by all means, it's probably easy to follow along. But at minimum, the long-term care organizations will commit to this 3-year pre-designate partnership with RNAO. And again, this partnership contract is renewed annually and reviewed, provided criteria are met. And that you'll need to contribute the necessary financial resources to support guideline implementation, evaluation, and sustainability during that initial 3-year pre-designation period and ongoing as a long-term care BPSO designate. And this is important to think about how does this work fit with your strategic plans and your strategic priorities, just as was mentioned previously. So when we're talking about systematic implementation, we're talking about a variety of different things, and I'll speak to some of these in some detail. We utilize the implementation toolkit, the RNAO implementation toolkit, which is based on the knowledge to action framework in terms of a framework to help move evidence into practice, looking at having steering committees, coaches, capacity building, dissemination, evaluation, and regular reporting. So I'll speak to each of those individually. So again, the BPSO deliverables for implementation are such that we're asking that a minimum of 3 RNAO clinical practice guidelines, they need to be clinical practice guidelines, are implemented. A minimum of 1 guideline for implementation, preferably 2, must be selected from the following mandatory list. So the list includes foot ulcers for people with diabetes, pressure injuries, assessment and management, assessment of pain, and management of pain, and preventing falls and reducing injury from falls. So those are the mandatory list, and you can pick 1 or 2 from that series. Again, minimum of 3. So these are the other guidelines that are available for you to implement based on the specific needs that you have within your home. So again, you can focus on that first mandatory list that I mentioned. You can pick 1. You need to pick 1 from that list, or you can pick 2 or 3 from that list if that meets your needs. But certainly this list provides a range of guidelines that can help you meet your requirements for your long-term care residents. Now, having picked your 3 guidelines, one of the guidelines needs to be implemented across the entire long-term care home. And when we talk about that, we really do mean across the entire long-term care home, so that the intention being that everyone within the home, all the staff within the home, and all the residents will be impacted in some way by the implementation of the best practice guideline. All of the guidelines need to be implemented by the end of year 2, so those 3 guidelines that you've selected need to be implemented by the end of year 2, so that you can really focus on evaluation and sustainability in year 3. So for homes with multiple sites, and we've heard from Tracy their multiple site situation, you can select 1 site to initiate your BPSO work and plan to spread to other sites once you become a long-term care BPSO designate, or you might choose to conduct the long-term care BPSO work across the entire organization at all sites. And if you choose this option, the guidelines selected to be implemented across the long-term care home must be implemented at all sites. So it's really, again, an opportunity to look at consistent practices across multiple sites. Again, you may choose to integrate RNAO nursing order sets within your electronic medical record systems for those guidelines that are being implemented across the entire organization. This is not a mandatory requirement, but something that you might wish to consider, and there's information about our nursing order sets on the RNAO website. One of the other elements in terms of implementation and requirements is to engage a critical mass of at least 15% of caregiving and management staff as RNAO best practice champions. And this is an expectation by the end of year 3. But there are some champion development targets that we've found are helpful to have in terms of a target for you so that you're able to achieve that 15% by the end of year 3. So at year 1, we're looking at 6% of staff. By year 2, an additional 6%, totaling 12%. And by year 3, an additional 3%, totaling 15%. And many of our organizations exceed that 15%, but again, the intention is that you have a cohort of individuals who have a common understanding of guideline implementation and the process for moving practice change forward. Champions can be developed by the attending at in-person workshops, virtual webinar series, or through our online e-learning program. So again, we're still with the implementation deliverables, and one of the things we found to be highly necessary and effective in ensuring ongoing guideline implementation and sustainability is the existence of a steering committee. And you can call it whatever you like, but we're calling it just a steering committee to give it a placeholder. But really, it's a group within your organization who has responsibility and accountability for monitoring and following up on the BPSO work, that there's some reporting to the senior management team within the organization through the steering committee. It might be an existing committee that you already have that's involved with quality management and risk, or it may be a new committee that you create just specifically for your long-term care BPSO experience. As Simmons mentioned earlier, you'll need a long-term care BPSO liaison or lead who will be dedicated to leading this work and coordinating the work and monitoring the deliverables of the BPSO within your long-term care homes. And again, we'll provide a long-term care BPSO coach who will be one of our long-term care best practice coordinators who works in the regional area that your home is in. And again, their role is really to provide coaching, consultation, et cetera, not as an active member of your implementation team, but rather as a coach who can help move you through and teach you the implementation process. We've talked a little bit about champions already. So again, this is a requirement for implementation is that 15% of champions and being able to achieve that over the 3-year period. There's also a requirement, again, through capacity building, and these are all really focusing on, the individual champions as developing their knowledge and skills, and also developing some specialized knowledge and skills in a core group of individuals within your organization. So over the course of the 3-year pre-designate period, there is a requirement that each long-term care BPSO sends a minimum of 1 staff member, registered nurse, registered practical nurse. Most often, the first year, they'll send their BPSO liaison to what we call our Clinical Best Practice Guidelines Institute, which runs for a week in June every year. There's a foundational stream and an advanced stream, and some of you have been in attendance at this in the past. But really, the focus is on guideline implementation, the use of the toolkit, et cetera, and it really provides a strong foundation for understanding the process for guideline implementation. Not so much about the content of the clinical guidelines, but rather really the process of guideline implementation, evaluation, thinking about sustainability. And we've certainly had very strong feedback from all of our BPSOs that this was really foundational to their understanding of the process for guideline implementation, and they found it very valuable to participate early on in their work. RNAO is able to fund the attendance and travel for one of your staff members to attend either the foundational or the advanced stream each year, and that money will be coming from the funds that we receive from the Ministry of Health and Long-Term Care. Again, another capacity building deliverable is the Advanced Clinical Practice Fellowship Program and an application for an RN to participate in the ACPF program over the span of the 3-year pre-designate period. So there is a requirement that during the course of that 3-year pre-designate time period, one application, a minimum of one application will be submitted by the long-term care home for an RN to participate in the program. This particular program, for those of you that may not be familiar with it, it's funded specifically for registered nurses by the Ministry of Health and Long-Term Care. And each of the fellowships, each of the successful fellows receives $13,000 to help support their learning related to a variety of different topics. It can be on clinical focus, leadership, guideline implementation, obviously, is what we're interested in, or a new stream on focusing on humane, compassionate, patient-centered care. So that $13,000 can be utilized to help support the time required for your staff member to participate in the ACPF program. I think I've spoken to all of this already. Again, capacity building deliverables, knowledge exchange. And one of the things that we are continue to work with our BPSO liaisons and leads and our coaches is opportunities for sharing and understanding some of the issues, the challenges that people are experiencing, celebrating some of the successes that individuals are having, and brainstorming and sharing ideas for moving guidelines into practice. And so we do have monthly knowledge exchange webinars with all of these individuals. We coordinate those on a monthly basis. They're led by our RNAO team here, BPSO team here, but it does include all of the liaisons or leads, coaches, and other members of our team. We'll bring guest speakers forward. We'll have opportunities for teams to share their specific strategies that they might wish to talk about, etc., so that we can continue to learn from each other. Another capacity building deliverable is the annual Best Practice Spotlight Organization Knowledge Exchange Symposium. So all of our BPSOs, whether they're pre-designate or designate, whether they're long-term care or acute care, etc., all support the attendance of at least 2 key staff to the annual Knowledge Exchange Symposium. And we will provide funding during your pre-designation years for travel and accommodation for those staff to join us for the day. This is a full-day meeting that we have every spring. The time changes between March and April, but it's usually at that time. We'll be in Toronto. And again, it's an opportunity to meet with a much larger group of BPSOs. There's usually about 150 to 160 individuals in attendance. And again, opportunity to share their learnings and activities related to guideline implementation, evaluation, and sustainability. Also in capacity building, we're looking at opportunities for mentorship. And so for our long-term care BPSOs who are designates, we're looking at opportunities for them to mentor new BPSOs. And of course, we haven't got enough designate BPSOs at this time to mentor all of our pre-designate BPSOs, but we definitely look for opportunities to make those connections either through that knowledge exchange, dialogue and discussion, or on a more one-on-one basis through introductions to others who might be implementing the same guideline as you, for example, or for those that have a particular question or an issue that they're challenged with, we're looking for connections so that you can learn from others. So just in terms of the capacity building deliverables, we were looking at the champions. We've spoken about the requirement for advanced clinical practice fellowship submission, attendance at the Clinical BPG Institute, participation, active participation in the knowledge exchange, and again, looking at opportunities for mentorship. Now, in terms of sustainability, you'll note that when I spoke about the implementation requirements, I indicated that the implementation of the guidelines, the 3 guidelines, needed to be completed by the end of year 2. And one of the things that we've really recognized over time is, with our actually over 15 years now of working with BPSOs, is that there's an absolute need to really think about sustainability and what structures need to be put in place to be able to support ongoing sustainability of the practice changes you're putting into place. And so that 3rd year of your pre-designation allows you the opportunity to really integrate and leverage some of your existing structures that you have in place, solidify some of your practice changes that you've made, finalize any policy changes that need to take place in order to make sure that guideline implementation continues in the long run, et cetera. And so the sustainability component of that starts really from the beginning of your implementation work, as you're starting to think about strategies to keep practices moving in this direction ongoingly, but also certainly having a written sustainability plan so that you have an identification of the people or the roles that might need to be in place, organizational supports, and processes that need to be in place within the organization to help you maintain your gains. Now, there are also deliverables related to reporting, and because this is a contractual relationship that we have between ourselves, there is a requirement for BPSOs to submit a written report twice per year, highlighting the progress being made towards the deliverables. We will provide an online report template, and actually our reporting deadline is coming up very quickly. Actually, it's next week. An online report template will be provided to you, and it's really focused on the deliverables that I've spoken about, your progress related to implementation and evaluation, selection of indicators, as well as how you're progressing with achieving progress related to your outcomes. The RNEO team here will review each report. That includes Suman and myself, the BPSO coach, and possibly other members of the team. And we meet with the BPSO teams via teleconference for about an hour, actually, to highlight successes, reinforce successful approaches, ask questions, identify areas of challenge, and discuss need for additional support. And after the end of each year, the partnership with RNEO is reviewed and renewed annually, again, provided that deliverables are being met. In terms of monitoring and evaluation, and I'm sorry about the black spot on the slide deck here, but it's Nursing Quality Indicators for Reporting and Evaluation is also referred to as NQUIRE, by short, in the acronym. And the goals for NQUIRE is to develop a robust data system for reporting, monitoring, and research that demonstrates the value of how evidence-based nursing practice improves health outcomes. As the data system expands, it will impact practice, management, and policy decisions, education, and health system research. And so there are some requirements for NQUIRE that I'll speak to, but I just wanted to show you this slide, that it's really bringing information from the clinical area, whether that be through paper charting or, very fortunately in long-term care, the access to electronic health records, being able to import that information through BPG indicators that are developed directly related to the recommendations contained within the guidelines. Obviously, the data collection and data submission is through a web-based form, and then you're able to actually produce your own NQUIRE reports. And so you can look at being able to compare yourself within your organization and ultimately actually be able to compare yourself, should you wish to, with other like organizations that have data within NQUIRE. And so in terms of the criteria for NQUIRE participation is mandatory for all BPSOs, whether they're long-term care BPSOs, other BPSOs in Ontario, in Canada, or internationally. Everybody is participating in this program. So the minimum requirement is to collect data, either monthly, quarterly, or annually, depending on the indicator, consistently for units, teams, programs, or services. That would include a minimum of 2 human resources structure indicators collected at the unit level. And again, the human resource structure indicators aren't aren't guideline specific. They're really more looking at the structure of your staffing models. So 2 human resources structure indicators and 1 NQUIRE process indicator and 1 NQUIRE outcome indicator, or at minimum the 1 guideline. Mandatory guidelines selected for implementation. So that the minimum requirement is 2 HR structure indicators and 2 NQUIRE indicators, 1 process, 1 outcome for that mandatory guideline that you identified in the selection from that first table I shared with you. And then baseline data submission is required on the process and outcome indicators chosen above for a period of 3 to 12 months if the data is available prior to the initiation of implementation activities. So again, we're really trying to get a sense of what the sort of status was at the beginning before you start the implementation. RNEO will provide the data collection requirements and tools via NQUIRE for the quality indicators chosen for monitoring and evaluating guideline implementation. And data collected will not include any individual resident identifiers, and it will all be aggregated to determine the impact of clinical guidelines on resident outcomes and nursing practice. So we're not collecting patient-level data. It will all be rolled up so that it's aggregated and that we won't be able to identify any individual residents. In In addition, BPSOs will conduct regular quality improvement monitoring activities that you're already involved in directly related to your many required programs and services related to each guideline being implemented, and support and submit results in your biennial reports to RNAO. So, you know, twice a year we're looking to see how are you progressing with your outcomes and how are the guideline implementation making an impact on the care of residents and their outcomes. We also provide opportunities for you to take advantage to participate in research projects, and of course that's really very dependent on your interest and whether that you think that that would be appropriate for your home. And you certainly are eligible to become an organizational member of the Nursing Best Practice Research Center, or the NBPRC, which will provide you with opportunities for linking with researchers and others related to evidence-based practice and guideline implementation. So moving on to dissemination deliverables, and I'm just keeping an eye on the time because I want to make sure that we have opportunities for any of your questions, but it is an expectation that over the 3-year period, long-term care BPSOs would either present at conferences, participate in RNAO events as faculty, so both Susan and Tracy were here with us today as part of our dissemination activities, share implementation resources. A manuscript submission is actually a requirement, and over the 3-year period, all of our BPSOs are expected to submit a manuscript for publication. Have a website that has a clear use of the BPSO logo and opportunities to disseminate your work via your website. A social media presence, if that's possible within your organization. I realize some organizations aren't able to have or have specific policies related to social media, but certainly if you're able to, that's an expectation. And then again, as I mentioned previously, the use of the BPSO logo on all relevant resource material. So how does this all work? So once you've reviewed the RFP, you'll find that and recognize that each section of the RFP is actually weighted slightly differently. So scope of work is worth 20%, and in there we're really wanting to understand, you know, your organization, which guidelines have you selected, why, how much impact is that going to have within the organization or in your home, and the goals that you want to achieve. Organizational support is also extremely important and is weighted at 20%. Previous experience with guideline implementation, 10%. On the long-term care BPSO's team's knowledge, skill, and experience, 15%. On capacity to deliver on the outcomes, there's requirements, and sustain those outcomes, 20%. So again, here we're looking at a variety of different elements related to your capacity to be able to do those, or deliver on those various things I've just mentioned. And then, of course, financial contributions and what kind of a budget are you anticipating is going to be required to support this work. So in terms of the review process, once we do review, obviously and I should mention that it is an online application, and so we will be, after the date of the letters of intent, which I'll mention shortly, we'll be receiving access to the online form. And the online form really goes through in detail each section of the RFP and asks specific questions for you to respond to that will help guide your, the amount of detail that's required for each of those areas that I mentioned in the previous slide. We will have a review committee, and each proposal will be reviewed independently by 4 to 5 reviewers using an established scoring matrix, again, an online review form that we utilize to be consistent across our reviewers. Successful applicants will be identified based on the review scores and the feedback from the reviewers, and then we'll be informing the applicants in writing of the status of their application, regardless of whether they're successful or not. So important dates, the RFP release happened last week, October the 5th. The letter of intent deadline will be November the 13th, and for the letter of intent, all we really need is an indication that you're planning to submit a proposal and that you understand the scope of the work that's to be delivered through the BPSO. This helps us with our planning for the review process, determining how many reviewers we need, and also being prepared to receive your application on December the 7th, which is the deadline for the RFP. We'll be releasing the results in late January, very early February, at which time we'll be issuing contracts for the successful sites that they'll need to sign. And then a BPSO launch date is identified for April the 10th, 2018. So that will be the date that we bring all of the new BPSOs together and have an opportunity to dialogue and share with them sort of the orientation, if you will, to the BPSO program. So at this point, I will say that if you have specific questions about the RFP itself, they need to be received in writing or by email no later than November the 30th. And then those would go to the email identified in the RFP and on this slide to the attention of Heather McConnell, Associate Director. They'll come to me, and then we'll respond to any of your queries about the RFP directly by email in a written response. So at this point, I'm going to recognize that we've got about 10 minutes left, and we'll open it up to any questions. I'm just looking to see, Suman, do we have some questions there?
So yes, we do. We will be, the session is being recorded, and the recording will be posted on the website, and a PDF of the slides will be sent out to the attendees.
Thank you. Any other questions that anybody would like to ask? If you'd like to ask a question on the phone, please just press *7 to unmute your line, and we'd be happy to take your question. If you'd rather ask a question on the chat box, that's absolutely fine too. Just need to type it in, and we'll wait for a few moments just to make sure that everybody's had an opportunity to consider a question or any clarifications that you need at this time.
Again, just to ask a question, you need to unmute your line, press *7.
Okay, well, we haven't received any more questions in the chat box, and I don't hear any questions coming forward on the phone, so I think if that's the case, we'll wrap up the call. Sorry, I'm just looking to make sure I haven't missed any questions here, but yes, we will definitely be issuing the slides. They'll be posted on our website along with the recording, and we'll share them with those of you that are on the line. If you have colleagues that you think would benefit from joining us or would like to actually join the live webinar, we will be conducting a second webinar, same content. It'll be the same webinar with different guest speakers on October the 19th from 1:30 to 2:30, so by all means do have people join us. But we absolutely will have this our recording posted on our website to provide a backup resource for those of you who may need to dialogue about this with others within your organization, or if you want to review any of the information that we've shared with you today. So again, thank you so very much for joining us. It's a pleasure to have so many of you on the call with us, and we'll look forward to your letters of intent coming to us on November the 13th. Thank you all very much. Have a good afternoon.